Welcome back to The Breakfast Show. The time right now, coming up to 10 minutes past 9 a.m. And a quick question for you, Jo.
Yes.
What's your blood type?
B positive.
Oh, very good.
I knew you were going to ask me.
Yes. Well, you know, I've actually been asking a bunch of people because, you know, I've been in and out of hospital for the last 2 months. And you'd be surprised how people don't actually know their blood type.
That is true, though.
In this country. It's quite fascinating.
Frightening.
Well, frightening would be another word for it.
Yeah.
And, you know, I guess if you're ever abroad or, you know, away from your own local doctor, perhaps, how do you get all your medical information?
True. I mean, a lot of people find themselves in a bind because they simply cannot access these medical records. But today, our first topic of discussion is a brand new device that will allow you to keep your medical records in your wallet.
That's right. Yes.
And to tell us more about it, we have with us the CEO of Malaysia Healthcare, Suresh Ponnudurai. Welcome to the show.
Thank you. All right. Well, let me just first of all pick this little device up and take a look. Now, it's about the size of like a lift access card, I guess, would be about the right way of doing that. And now, tell us, what can this do?
This is called a personal health record, and basically it carries all your medical information. Your medications, your allergies, your immunizations, your x-rays, your echocardiograms, everything can be loaded into this portable device.
Okay. Now, it kind of goes by USB.
Yeah.
That's the unique feature about this. It's interoperable. In other words, you can access this information as long as you have a computer.
And you don't need internet access.
You do not
all you need really is a computer on the other end.
And we find internet penetration not 100%, as you know.
Right.
So what do you do if it is loaded on the net? You don't have access. This card bypasses that problem.
Okay.
Okay,
And
right.
do you need a certain program to be able to read the card, or is it just, you know,
Plug and
Microsoft?
Plug and play.
Plug
you
and play.
Put it in, but it's highly secure. You need to have a password to get in. It's highly encrypted, so you know, it's HIPAA compliant.
That's what I was going to say. I mean, the data that you put on here, that's not open for everyone to just see anytime, anywhere, is it? This is completely private. It's all secure.
Absolutely. Because it's owned by yourself. You own it. You decide who's going to access this information.
Okay.
So by that, it is private.
Okay. Now, how does this actually work? Does this mean that you carry it around with you all the time, and whenever you go and see a doctor or you go to hospital or anything like that, they will put your scans and things on this device?
Today, what happens when you leave a hospital? I mean, you get a CD, possibly.
Or a big fat envelope with your X-ray in it.
Absolutely. And if you look at health tourism, where people are traveling now globally for healthcare, how do they carry all this information? This portable device obviously makes it a lot easier for patients to now, you know, move around with their medical information. And the beauty of it is, you can translate this into several languages.
Oh,
so
great.
you can convert all that data into German, French, Spanish, you know, you name it. The major languages are already there.
Excellent.
Oh, wow.
So no matter where you are in the world.
Absolutely. So if you go back to your home country, or let's say if you are traveling in a country that doesn't obviously comprehend English, then with the click of a button, everything will convert into that language.
Are hospitals around the world equipped to use this, though?
Because it's Microsoft operating, generally, yes.
Yes.
As long as you have that.
How functional is it in our local hospitals?
It is functional, but adoption is obviously a key issue.
Right.
Because it's new. But the reality is digitizing of medical information is now becoming a main topic of interest globally. And it is the next level of healthcare. So this is actually part of that whole era.
Okay, well, maybe you can just show us. I mean, obviously, it's USB, so you can just kind of pop it out and stick it into things. But how does it actually work? And I know you've got a laptop here, so you can actually show us. We'll just turn this around, and we'll get a camera just to focus on this.
As soon as it's simple enough. It just plugs into your USB and to any computer that has Microsoft, as I just mentioned. But as soon as you get in and you put in your password, you have now access to the main screen, which gives you your basic demographic information.
Okay.
And just imagine if there's a doctor who doesn't know anything about you and you're unconscious or anything like that. For the first time, he knows who you are.
Right.
He has your basic demographic information. He knows your, you know, which countries you've visited, especially in H1N1.
Well, and that's very important nowadays.
Absolutely. Your current condition, you may be diabetic, you may be, you know, hypertensive, or whatever. Your recent surgeries, the basic information is already there. Now, I'm not going to go through all of these because there's a whole bunch of areas here that you can go in. It's very, very comprehensive. You know, you can put in your medications, What you're seeing here is already integrated into the card.
Okay, right.
So
So these are all just on there?
Absolutely. There's no internet access here. What you're seeing is already in front of you.
Right, so anytime you just need to update the information, you plug it in and key it into the respective fields.
Absolutely.
Wow.
So the data really should be up to the person who owns the card.
Oh, okay, right.
So in other words, if this is adopted correctly, and it works in the ideal situation where the hospitals and healthcare providers are willing to embrace this, whatever they're giving the patients can be loaded in the hospitals itself.
Okay.
So,
Sorry, but does that mean that people can edit it themselves at home?
you can load this information, but you cannot remove it for security purposes.
Right, okay. So
You can do it on your own, though.
you can do it on your own.
But
so
it will be up to the doctor once you give him permission to see this information to
Right.
assess what that information is.
Okay.
Can he then copy it into his own computer?
No, for security purposes, and because this is a U.S. patented software. HIPAA is, the privacy laws in the U.S. are the tightest anywhere in the
Right.
world. You cannot download this information into your hard drive. You cannot remove this information.
So it's all private, confidential,
Absolutely.
that's all fine.
Absolutely.
Okay, great.
So,
Please carry
yeah,
on.
I'll just go very quickly. I mean, you can go in, for those who want to get involved in managing their blood pressure, you can do it now. Preventive health is becoming very important.
Okay.
Your sugar levels can be managed. Your BMI, there's a huge obesity problem. These areas are non-confidential.
Okay.
You can actually do this, and you can email all this information to your doctors without having to go to the healthcare provider and
Right.
update them with your...
Is there a way of
your-
emailing it through the program itself?
Absolutely.
Oh, wow.
Absolutely. And you
Okay.
can print this out in reports, etc.
Oh, great.
It's
Okay.
very, very user-friendly. So if you talk about drugs, the medications that you have are already loaded here and globally recognized.
So can you take this to, let's say, a pharmacist, and then they could just pop it in and...
Absolutely. That would be the ideal situation if Malaysia at some point gets to integrate its healthcare stakeholders.
So I imagine the big picture of this could be amazing. In the future, they could just sort of plug this into different machines and automatically get updates. You could swipe it at pharmacies, and
Absolutely.
even when you go through airports, you could even
Yeah.
beep it to show which countries you've been in and for how long.
Absolutely. The word is interoperable. You can use it anywhere. And that's the beauty of this product and this device. So the reality is, all the drugs here are recognized anywhere you go, anywhere in the world. And you can load it in yourself. You can put in the brand, the pharmacy, the description, the dosage. You can do it yourself.
Is that clever, though, to allow laymen to be updating their own sort of medical records, though? Because anyone can actually just update it themselves, right?
They can.
Okay.
They can.
They
but
don't need a doctor sort of permission to actually write that down or anything like that?
No, absolutely, you can do it yourself.
Okay.
But the reality is, at the end of it all, you're going to go back to a doctor.
Of course.
And the doctor
Right.
is going to look at this information and make his own assessment of it.
Okay, right.
Please bear in mind, this is a historical storage device.
Right.
It's not going to give a doctor, it just gives the doctor an indication of your health.
Right.
If you had a scan of a tumor 3 months ago, that size of tumor may have changed in size.
Right.
So he'll still scan you.
Okay.
But he has an idea now of your present condition.
He knows that you have already been scanned.
Absolutely.
for
So
a
therefore,
tumor.
the medical information that lies in the hospital still stays. This is just going to be an information that will help that doctor.
Right, and I guess it's more essential for things like emergency situations as well.
Precisely.
Will sort of EMTs and stuff be able to go through these, or is that the idea that eventually, like, let's say you're in an ambulance, they'll be able to just kind of go through your wallet, pick this out, plug it in, and then say, oh, okay, don't give him penicillin or something like that?
Absolutely. If you are unconscious in an ambulance, if you had a notebook in here, this information could be emailed directly to the health
Right.
care provider before you arrive. All this information is already there.
And how long does it take when you plug it in to actually call the information up?
Within seconds, it's
within
very
seconds,
fast because
right.
the software is patented. And the beauty of it, it's also done in such a way for those hospitals that are already paperless, digitized. The tables can be exported automatically.
Oh, wow.
Information automatically imported into the software and exported back into the card.
Okay.
So there is no manual input. But as you know, because it's a new product, the adoption is there, we still have to manually input this.
Right.
And Malaysia Healthcare.com basically has its own team of people ready to do this for them.
Oh.
Yeah.
So I'm assuming this is already available in the market. It's actually got a name which we have not yet mentioned the entire time we've been
True,
talking.
yes. The iPHER, is it?
Yeah.
And so I guess a lot of people want to know. I mean, this will come in very handy because nobody wants to be carrying around big, paper files with them.
Sure.
But at what cost?
It's made, we believe, to be as affordable as possible. But obviously, there is a cost to the card.
Okay.
And in order to get to that a certain level of volume, to make this thing available for everyone, the actual cost we're looking at is about 100 ringgit.
Okay.
It's about 25 US per card.
Right. And there's no subscription or anything for it, is there? Or?
No, it's up to you. If there is an update of the software, it'll be about 20 ringgit or so every year, annually. But it's up to you. I mean, you don't need to update this. It's already very comprehensive.
So if people do want to, get one of these, where would they go?
MalaysiaHealthcare.com. You can actually make your orders through the portal.
Okay.
And is it handy to perhaps have a backup of one of these? Because obviously you're going to be carrying around your wallet and things, but is it perhaps good to have one with a loved one or a next of kin so that they have your records on?
Absolutely, but what we do is we do back your information up on a server.
Okay, all right.
And it's a delimited server. It's specially coded, where we separate out your demographics from your medical information.
Okay.
By law, we are not supposed to know anything about your health information.
That's right, yeah.
Okay.
So it's serial coded. If you lose the card or damage the card, we can reload everything by serial code back into the card and FedEx it to you. This is we're going to be marketed all over the world, not just in Malaysia.
Okay.
So we can do this very quickly.
So it goes up to the server. It's all encrypted on there. So
once you load the information, there's a button in there. You just click update and it just backs up.
Excellent.
Brilliant.
Right.
It's very simple.
Okay, so you don't have to worry about losing it all and then having
it all
to start
depends
from
on
scratch.
whether you update the information.
Of course. Well, that adds a whole extra level of security to it then, doesn't it? Because, I mean, some people who do actually keep their medical records in boxes at home, if there's a fire or a flood or something, then they lose it all.
Everything.
Absolutely.
Okay, right. So this is available already in the market, and I guess hospitals already know it.
They know of it, but it's new.
Okay.
And it is our hope, it is Malaysia Healthcare's hope that this will be adopted in the near future.
What are you doing to speed up, perhaps, the adoption of these cards in our local hospitals?
I think at the end of it all, the question should be asked, is it patient-centric or is it hospital-centric? And the reality is, I think this is more patient-centric. It should be patients. People like us should ask the question, do we need to carry our health information? And I think today's world, you do, with the way, with globalization and people traveling every other day, it is important to carry your basic information. We are not asking for sensitive information, just the basic information that individuals should be allowed to carry.
Yeah, really, it could save your life.
It definitely could, yeah.
Absolutely.
So I guess the next step would be microchips under the skin, right?
But I'm sure that'll happen down the road.
Soon enough.
Yeah, exactly.
Well, thank you so much, Suresh. Unfortunately, we have run out of time. But if you'd like to find out more or purchase one of these cards, the iPHER, that website again is www.malaysiahealthcare.com.
That's right. I would like to get one of these, actually. It's very cool. We are going to take a quick commercial break.